When it comes to Medicare Advantage plans, one phrase catches almost everyone's attention: $0 premium. It sounds like a dream, right? A health insurance plan that costs nothing every month? Especially for people on a fixed income, it feels like the best possible deal. But as we move into 2026, the question becomes, are these zero-premium Medicare Advantage plans really worth it? Or are there hidden costs and trade-offs that you need to know before signing up? In this video, we'll dive deep into exactly what these plans are, how they work, what's changing in 2026, and whether they truly save you money in the long run. By the end of this video, you'll have a clear understanding of whether a zero-premium plan is the right fit for you, or if it could end up costing you more than you expect. Let's start with what a zero-premium Medicare Advantage plan actually means. In simple terms, it's a Medicare Advantage plan where you pay no additional monthly premium beyond your standard Medicare Part B premium. That's the amount that's usually deducted from your Social Security check, around $185 per month in 2025, and expected to rise to about $206.50 in 2026. The $0 part just means you don't pay an extra charge to your insurance company for your Advantage plan. But that doesn't mean the plan is free. You'll still pay copays, deductibles, and other out-of-pocket costs when you actually use your healthcare. So how do insurance companies like Humana, UnitedHealthcare, Aetna, and Kaiser Permanente afford to offer these zero-premium plans? The answer lies in how Medicare Advantage is funded. Medicare pays private insurance companies a fixed amount every month for each enrollee, regardless of how much medical care that person uses. These companies then use that payment to cover your benefits, hospital visits, doctor appointments, prescriptions, and sometimes even extras like dental or vision. If the insurance company manages your care efficiently and you stay healthy, they make a profit. If your medical costs are higher, they may lose money on you. It's a business model that rewards prevention and cost control. Now, in 2026, zero-premium plans are expected to remain extremely popular. According to early projections, about 60% of Medicare Advantage enrollees will choose a zero-premium option, continuing a strong trend from previous years. Why? Because these plans often include added benefits that traditional Medicare doesn't, things like prescription drug coverage, gym memberships, dental, hearing, and vision care, and even transportation services. Some companies like Aetna Medicare Advantage or Humana Gold Plus include over-the-counter allowances that let you buy health products like vitamins and first aid supplies at no extra cost. On paper, it looks like a great deal, and for many people, it truly is. But the zero premium label can be misleading if you don't understand what's behind it. Let's talk about the real costs of these plans. While you might not pay a monthly premium, you'll still face costs when you actually use medical services. For example, you could have a $20 or $30 copay every time you visit your primary care doctor, $50 for specialists, and hundreds of dollars per day if you're hospitalized. The average maximum out-of-pocket limit for 2026 Medicare Advantage plans is expected to be around $8,850, which means that's the most you'd have to pay in a worst-case scenario. That's a big difference from Medigap plans, where you might pay a higher premium every month but far less out-of-pocket when you need care. And that's where many seniors get caught off guard. The zero-premium plan looks perfect when you're healthy and not visiting doctors often. But if your health changes, say you develop a chronic condition or need frequent care, those copays and costs can add up very quickly. A study by the Kaiser Family Foundation found that the average Medicare Advantage enrollee pays around $1,500 a year out of pocket, not counting premiums. And that number can go much higher for people with multiple medical needs. Now, before we dive deeper into the pros and cons, let's take a quick pause. If you're finding this information helpful, make sure to subscribe to our channel. We share videos like this every day to help you make smart Medicare decisions, understand policy changes, and find ways to save money on your healthcare. So go ahead, hit that subscribe button, and let's keep going. Alright, let's break down the pros first, because zero-premium Medicare Advantage plans do have some major benefits. The most obvious one is affordability. For people living on Social Security or fixed income, saving $50 or $100 a month in plan premiums can make a real difference. These plans can also simplify your healthcare since they often bundle hospital, medical, and prescription drug coverage all under one plan. That means instead of juggling multiple insurance cards and bills, you deal with one insurance provider. Companies like UnitedHealthcare and Humana have built their Advantage plans to be easy to use and loaded with extra perks, telehealth visits, fitness programs like silver sneakers, and even grocery cards for healthy food in some areas. Another big advantage is the extra benefits that traditional Medicare simply doesn't cover. Original Medicare doesn't pay for dental, hearing, or vision, but many zero-premium Advantage plans do. In fact, in 2026, even more insurers are expected to expand dental coverage limits and preventive services because of growing competition. Some plans even include worldwide emergency coverage for travelers, something you'd never get under original Medicare. So yes, for a healthy individual or couple who wants an all-in-one plan and is comfortable staying within a provider network, zero-premium Medicare Advantage plans can be a very good choice. But now let's be real about the cons. The first big drawback is network restrictions. Most Medicare Advantage plans use either an HMO or PPO model. With an HMO, you have to use the doctors and hospitals within the plan's network unless it's an emergency. That means if you move, travel, or want to see a specific specialist who's not covered, you could face high costs or be denied coverage. PPO plans offer more flexibility, but even then, out-of-network care usually costs more. This is where people with Medigap plans, who can see any doctor that accepts Medicare, have a big advantage. The second con is out-of-pocket unpredictability. With zero-premium plans, you never really know what your annual costs will be because they depend on how much medical care you need. A year with few doctor visits could be cheap, but one hospital stay or expensive medication could blow your budget. In contrast, a Medigap Plan G, for example, might cost you around $120 to $160 a month, but after that, you have almost no out-of-pocket costs for covered services. It's a trade-off: pay less now, or pay more later when you actually need care. Another potential issue is prior authorization, something that frustrates many Medicare Advantage enrollees. Before your plan covers certain services, like surgeries, rehab stays, or even MRIs, your doctor has to get approval from the insurance company. In 2026, Medicare is tightening oversight on this process to make it smoother, but it still causes delays for some patients. Traditional Medicare rarely has these kinds of hurdles, which is why some people prefer to stay with it and just add a Medigap supplement for predictable coverage. You should also know that not all zero-premium plans are available everywhere. Availability varies by county and even by zip code. For instance, Humana might offer an excellent $0 plan in Florida, while Aetna's top-rated plan might only be available in Texas or California. So when comparing plans, you'll need to look specifically at what's offered in your area and check each plan's provider network to make sure your doctors and hospitals are included. As for 2026 updates, expect to see more competition among insurers and slightly expanded coverage options. Some zero-premium plans will start to include even stronger prescription benefits thanks to the Medicare Part D reforms kicking in next year. That means lower drug cost caps and more predictable pricing. Also, there's growing talk of integrated care models, where plans will coordinate everything, from your doctor visits to your pharmacy needs, all under one system to make care easier and reduce duplication. However, don't let the marketing fool you. Insurance companies promote these plans heavily because they're profitable, but that doesn't mean they're right for everyone. The best approach is to compare the total value, not just the price tag. Use the Medicare Plan Finder tool on Medicare.gov or consult a licensed Medicare advisor who can show you a side-by-side comparison between zero-premium Advantage plans and traditional Medicare with Medigap. Focus on what you actually need: your prescriptions, your preferred doctors, your travel habits, rather than just the headline number. Here's a quick example. Let's say you have a UnitedHealthcare zero premium HMO plan. You pay $0 per month, but you have a $5,000 out-of-pocket max. If you're hospitalized twice and have multiple follow-up visits, you might hit that maximum. Meanwhile, your neighbor has a Medigap Plan G with a $150 monthly premium but pays almost nothing when they need care. Over the course of a year, you might actually spend more than they do, even though you started with a zero premium plan. That's why understanding your health needs is key. In short, zero premium Medicare Advantage plans in 2026 can absolutely be worth it, but only for the right person. If you're healthy, don't see specialists often, and are comfortable staying in-network, these plans can save you money and provide excellent all-in-one coverage. But if you want total freedom to choose your providers, or if you have ongoing medical needs, a Medigap plan might give you better peace of mind even if it costs more upfront. The bottom line is, zero premium doesn't mean zero cost. It just means your costs come later, when you actually use care. So, be strategic. Look at your total expected healthcare use, not just your monthly premium. Compare your options carefully, especially during the annual enrollment period from October 15th to December 7th. That's your best chance to switch or make changes that fit your health and budget for 2026. And if you found this topic helpful, we've covered several related videos on this channel. You'll see them appear at the end of this video. Check them out for more in-depth insights on Medicare Advantage plans, changes coming in 2026, and how to make the most of your coverage.